And I'm really excited about meeting Dr. Adler, almost 2 years ago. And he's one of these special type physicians that talks in shirt sleeve English. And rather than trying to complicate things, he makes things simple in your life and also can make you feel better about yourself, both visually and medically. His name is Dr. Philip Adler. Dr. Adler earned his medical degree at the Albert Einstein College of Medicine. He completed his residency in diagnostic imaging at Sinai Hospital, went to Wayne State Medical School, my favorite university, because that's where I left. In fact, they didn't even have all of those buildings up there when I left. And you know what's even worse? Some of the buildings I went to get classes, they tore down. I don't know if that's an indication of my studiousness, but anyway, they ain't there anymore. Then Dr. Adler went to become fellowship trained and acquire added board certification in the subspecialty of vascular and interventional radiology. He has been practicing vascular and minimally invasive medicine for over 15 years. After many years at a hospital practice and serving as its chief of interventional radiology, where he honored his expertise into minimally invasive vascular procedures, Dr. Adler sought to move to an outpatient setting. As medical director of Advantage Vein Institute, Dr. Adler has developed the ideal environment to best serve his patients. He and his wife Beth have made Michigan their home for over 20 years. Their family includes 5 wonderful children and their dog, Riley. So first question, Dr. Adler, is, how is Riley?
Riley's great. Thank you for asking.
Is he dealing, well, there used to be O'Reilly's life?
Yeah, O'Reilly. He's leading the life of Riley.
I see.
As only he can.
I see, right. Well, Dr. Adler, I know from my own legs, veins ain't the greatest thing to look at. So I thought, first of all, tell me about your specialty. You're involved in actually helping the appearance of the legs as well as the medical benefits of it. Is that correct?
Absolutely, yes.
Mhm.
So in terms of just elaborating on some of the background, I am, like you mentioned, a vascular and interventional radiologist, which means that I am essentially versed in all the diagnostic information, all of the imaging modalities, that is ultrasound and CAT scan and MRI and X-ray, fluoroscopy, which is moving X-ray, which is used to diagnose pathology, problems with blood vessels and other organs in the body. That was my initial training as a radiologist. Then in the fellowship that you mentioned, what we did was use those modalities, again, CT, ultrasound, MRI, X-ray, fluoroscopy, to do things within the body, to put things in places, in organs, in blood vessels, open them, close them, deliver medication, place catheters for continued intravenous access, or for delivery of chemotherapy or the like. And so the field that I involve myself in is much greater than the one area of vein work, but vein treatment is really a specialty in and of itself that requires both the diagnostic information that I have been trained in and the treatment in the least invasive fashion that I've trained in as well.
Mm-hmm. Well, there are folks out there that can appreciate how cosmetically negative it looks when you have veins, and the truth of it too is that veins have a great deal to do as an indication of your overall vascular system. But let's zero in on the leg part, because that's what especially women are always concerned about their appearance and all. If someone is interested in whether they're really a candidate for your type of practice, you've got a phone number here, 248 268 4634. Is that correct? 248 268 4634. Is that the right
Yep,
number?
that's correct.
Okay. So if they call you, what's the usual type of conversation that you have? If someone's concerned about veins, how do you go bring them into the office? Do you charge them initially for the exam, or how does that work?
Okay, well, we have two different approaches. For one thing, like you mentioned, people can look at their legs and see that they have veins. If the veins are something that bothers them, but they don't necessarily have problems with their legs, in other words, pain, heaviness, tiredness, achy, itchy, swelling, and that type of thing, they don't necessarily know that the veins are the cause of the problem, in which case we bring them in for what's called a free screening. We will look at their veins, discuss the problem independently, and then also try to determine whether this may just be the tip of the iceberg and that there are deeper veins that are contributing to the problem that can be treated, and often covered by insurance, in which case we would bring them back for a full consult, which would involve an ultrasound scan of the legs, where we look at the branching and the roadmap of the venous system, and also the direction of the flow. The reason that the veins are in the legs are particularly problematic is because veins are different than arteries. Veins need to have pumping by the musculature around them. When you walk and when you move and flex your muscles, that's how the blood returns to the heart. After a period of time, if somebody's veins stretch out because of different conditions, either there's a problem with their hormones, or they had been pregnant, or they have had a clot in the past, the veins stretch out, and what prevents the venous flow from going back to the heart and then returning back to the feet are what we call valves. But when the veins stretch out, the valves don't close next to each other, and the blood goes back and forth and back and forth, and ultimately some of it does return, but a lot of it stays because of gravity down by the lower extremities and the feet and the legs, and creates many of the symptoms that they may describe that we can treat through insurance. If it's a cosmetic issue, if it's just what we call spider veins, or veins that are just unsightly, and people want to do something about it, there certainly is a treatment for that, and we can discuss some of the options and treatment plans and potential payment plans. But more often than not, patients find that a lot of what's going on is something that is literally deeper than right on the surface.
So when you see a vein, without getting into song, you're so vain, it's actually not only from appearance standpoint that you might want to do something about it, but it's a signal that there's other factors involved. Is that correct?
It can very well be like you mentioned,
Signal.
a signal, and that again, it's the tip of the iceberg. And if you look underneath, there's a feeding vein where the valve isn't opposing itself. The blood flows right back down again, and creating symptoms that these people didn't know were related to their problem. Venous disease is very, very prevalent. It's almost 25 million Americans are suffering from it, and only 1.7 million people are really seeking care. 17 million people are seeking care. It's very prevalent with women because of hormones and because of previous pregnancies. 70% of people that seek care are women. It is more common than coronary artery disease, which is related to the heart, and it's many more times more common than the arterial disease, which is the flow to the lower extremities, the arterial flow to the lower extremities. So it's a very common problem, and people just don't know the extent to which their problems are related to venous disease.
I hate to make light of the anatomy, especially since you're a medical doctor, But when I give talks to senior groups, I tell people if you want to keep things simple as to how our bodies function, I compare it to a house. We're basically a plumbing and an electrical system. That's it, okay? And veins are part of the plumbing system.
That's a great analogy. Absolutely.
Except this is a little more serious. You can always go to Home Depot to replace a valve that's not functioning properly in your John. But when it comes to your life, correct me if I'm wrong, I used to use systems to try to remember different aspects of the whole body system and anatomy. And A for artery means that the blood is going away from the heart, and V is that it's on its return to the heart. Is that V?
That's
backward,
exactly what the way it works.
Right. So here's the signal. So when you see a vein, it means that the heart coming back, or the blood coming back, does not have exactly a clear plumbing tunnel to go through.
That could
right?
be the case.
So
absolutely.
so when they come in for that first visit and they call your phone number 248-268-4634. You just do some preliminary questioning by phone. Obviously, they have to come into the office, and it's very conveniently located. It's, if you can remember 7-Eleven stores, well, it's 26 7-Eleven Woodward Avenue, and you're right in the lower level there, so it's easier for people to get in. And that's in Huntington Woods. That's just north of what Mile Road?
It's actually just south of 11 Mile on Woodward Avenue.
Woodward, okay. So it's
on the
very
west side.
Well, Woodward is the main drag, and you're going to have a real dream time coming up.
Yeah, we're looking forward to the cruise.
So
we're actually going to have a booth on the outside for people if they want to stop by. We are going to be offering free screening even on the Saturday of the Dream Cruise. People can stop on by and just fill out a questionnaire and maybe get a picture with a car and have some memories of their veins and their experience in the 2014 Woodward Dream Cruise.
Wow! So you can actually have your legs as a dream and not a nightmare if you call Dr. Adler at 248-268-4634. And as an added incentive, since we're talking summer and fun stuff, I've got some free tickets to the Renaissance Festival. So if you'll consider calling Dr. Adler and talking to him, finding out maybe if not for yourself, you may have a friend that you might call on their behalf. We'll still give you the free tickets, or come by and have a dream on the Dream Cruise, and that's going to be right on Woodward, and you can get some of the questions answered, and most of the procedures that you do are covered by insurance in most cases. Is that correct?
That's correct. When patients have actual symptoms related to the venous disease, insurance will cover it. First, they like to start with what they consider conservative measures, which is compression stockings. They're very tight, but what they do is they close the vein down from externally internally. They basically squish the veins down, and that is essentially helping the return of the blood and avoiding the pooling of the blood in those veins. When that's completed, when they've done that, and then in the evenings, they take off their stockings and the symptoms recur, and they realize they need a much more permanent solution. What we then need to do is make certain that the veins that are critical for the blood return, which are in the deep vein system, are open. Then we need to close those veins down from the inside. So what we do, and this again is an FDA-approved procedure. It's an insured, covered procedure. It's called an ablation, and what it basically means is we make a tiny little puncture into the vein, and we thread up a catheter. Catheter is a little tube or a wire. And on that is a device that creates a little bit of heat. So after we've numbed up the surrounding soft tissue, we pull back this device, which is either a laser or a radio frequency device, and in doing so, it heats up the blood inside of the vein, creating a clot, which basically closes the vein down, and then we've essentially avoided the potential of pooling blood in this vessel, and eventually that vein shrinks down to a scar, and there's no more pooling of blood.
Hmm.
There are other methods that we use, including ultrasound-guided what we call sclerotherapy, which is also an ablation, but it's a chemical ablation. It's something that irritates the walls of the vein on the inside, creating a clot and shutting it down. So the bottom line is, from your analogy before, in terms of simplicity and plumbing, there's a leak, and we need to shut down the pipe. That's to which we attribute the leak that's creating a problem in the patient's legs.
Well, it's certainly a lot simpler for people to just come in, since that initial consultation is really free. If you're concerned about it, have a friend that's concerned about it, all they have to do is call you at 248-268-4634. But if you forget that number, you're always welcome to call our toll-free number, 888-489-8980. When we get back from our break, I want you to address some of the signals that, in our plumbing analogy, that people, unlike with the water leaking, that they should take a second look and call Dr. Philip Adler. Don't go away, who will be right back. Yes, and if you want to be in touch with Dr. Philip Adler, you can give us a call at toll-free number any time of the day, and we can arrange a free initial consultation. And if you actually get the appointment set up, if you visit with a doctor, you tell us when that date is, or after you've talked to the doctor, you can call our toll-free number, and I will give you 2 free tickets to the Renaissance Festival out in Holly. It's going to be every weekend starting in August, which is just a few days away, every weekend. So you can walk around with nicer legs many times just after the treatment. Tell me, Dr. Adler, speaking of that, somebody walks into the office and they do have one of the procedures done. Did you give them an anesthetic, or how does the procedure work?
It's known to be a fairly well-tolerated, not terribly painful procedure. We do not require general anesthetic. We do not require any major sedation. All we do is use numbing medication, like one would use at a dentist's office. In fact, it's somewhat dilute, and we put it all along the soft tissue that surrounds the vein that we're treating. Patients walk out the door. They are encouraged to walk the next day. They certainly can, that day for 20 minutes at a time, every hour, and then they can actually go back to work the next day. They will be wearing stockings to make sure that vein is collapsed upon itself, but otherwise they do very, very well. We don't have any mandatory medicine afterwards, no painkiller necessarily, because patients don't require it. It is a very tolerable outpatient in-office procedure that patients appreciate, because in the end their legs look, and more importantly, feel better. We don't require hospitalization, and it's very minimally invasive. Doesn't require any major incision, no suture or the like.
So you can literally walk in and walk out. You may walk out a little less comfortable than when you walked in, but it's not an overwhelming deal that you can't move at all.
No, of course not. They do very, very well walking out on their own volition. No crutches, no stretcher, no wheelchair, just walking right out the door.
Now you're located very conveniently right at 26711 Woodward Avenue, which is just south of 11 Mile Road. And if you want to sort of have the best of all worlds and see some cars, you're going to have your booth out there.
That's correct. We will have our own Woodward Dream Cruise booth, again, offering free screening that day as well. Questionnaire, and then come by and maybe you'll get a goodie, and we'll be able to help you with problems that you didn't even know you had that were related to your veins.
Right. And as far as some of the medical terms that they have is endovenous therapy. That's where you actually go into the vein. Is that right?
Sure. So endovenous basically means endo is on the inside, and venous is vein. So what we're doing is treating the vein from the inside outward, as opposed to like a venotomy or a phlebectomy or that type of thing, which is also done sometimes under certain circumstances. But this is basically doing a small treatment on the inside of the vein. And therapy basically implies, one of the different techniques we use, one of the different heating devices, or the chemical ablation, which basically means, again, shutting down, making the vein go away, become a scar, and not pool the blood and contribute to the problems the patient has.
And actually, there's also the situation where you have like a bulging varicose veins. Can you describe what the procedure is there?
Sure. Well, first we want to make certain that we treat the vein that's feeding it, in which case we may do an ablation of it with either the radiofrequency, the laser, or the sclerosant, or the medicine. And then if the vein is still bulging and in need of removal, a couple tiny little punctures and we actually can pull that vein out, and it won't be bulging on the surface anymore. The little scars are no bigger than a pen tip, and they heal very nicely, and the patient no longer has the ugly bulge on the skin surface. They have like a really nice cosmetic result, and that's called a phlebectomy, or a mini phlebectomy, or an ambulatory phlebectomy, and ultimately it removes the unsightly bulging vein.
So you can walk in with the bulge and walk out without the bulge. Is that correct?
That's correct. That's correct.
So call Dr. Philip Adler, and he can debulge you. How's that? I want to impress you with my medical terminology. Right now, by the sound of music, we run out of time, and I can only leave you with my favorite thought, which is yesterday is history, tomorrow is a mystery, today is a gift, and that's why we call it the present. Please enjoy your present by looking and living life with a bright side of aging.